Hello and welcome to Chairside Live. I'm your host Megan Strong. Thanks for stopping by. In today's episode, Dr. Anna Maria Muresan is entering the aesthetic zone. She's replacing some failing PFMs and restoring her patient's smile with BruxZir Anterior. She's also going to demonstrate how she uses a bone sounding gauge instrument for aesthetic analysis and a soft tissue laser to aid in creating a beautiful new smile. Dr. Muresan?
In today's clinical presentation, you will see a beautiful treatment outcome utilizing a material that is beginning to show an increase in popularity in the aesthetic zone. For this case, I took advantage of the appealing look of BruxZir material for the anterior restorations on 7 through 10 and my Picasso diode laser to aid in healing of the tissue. When these patients first walked into my office, she expressed her concern about her unattractive gingival color and the darker tooth that stood out against the much brighter PFM crowns on 8 and 9. Patient was unaware of the long-standing periapical infection depicted here on the X-ray of number 7. Upon clinical examination, patient had no symptoms, and to treat the chronic apical periodontitis, endodontic treatment was planned for the right lateral. The aesthetic evaluation shows severely inflamed gingival tissue around these faulty PFMs with margins that are probably invading the biological width. There is an obvious asymmetry in the incisal edges position among the centrals and the laterals, creating an unbalanced smile. Additionally, the shade of these crowns is noticeably lighter than her natural dentition. You can see me here using a bone sounding gauge for verification of the bony crest location. The first band indicates the average sulcus of 1 mm depth. The second line indicates the average osseous crest location, about 3 mm. We were borderline here at about 2.5 mm facially. After discussing with the patient her aesthetic concerns and communicating the changes in her new smile using the acrylic mock-up and the diagnostic wax-up, patient understood that first the infection and the cause of the diseased tissue has to be eliminated, followed by a healing period before achieving her aesthetic goals. After the endodontic treatment on number 7 was completed, the tooth was prepared and temporized, and the patient was asked to return for the removal of the defective crowns, for the removal of the diseased sulcular epithelium around 8 and 9, for which I will use a soft tissue laser, and for carie elimination, followed by build-up and preparation. Number 10 was included in the treatment plan to receive a BruxZir Anterior veneer. To aid in the predictability of the enamel reduction, I used the acrylic mock-up and a 3-banded calibrated burr from BruxZir USA. Sinking this burr through the acrylic into the tooth helped me create precise cuts to ensure preservation of enamel, which is critical in achieving a successful bonding. Upon removal of the PFM crowns, we can observe that a significant amount of leakage took place under these margins. While re-prepping 8 and 9, I was very careful to stay equigingivally and not to further drop the margin apically. We can note that the biggest challenge for the technician here will be matching the shade between the restorations that will be placed on the non-vital dark stumps of 7 and 8 with the restoration placed on the vital teeth 9 and 10. To avoid the shade discrepancy and to help the technician achieve patient's desired shade, there are few techniques that I use to cover a dark area of the prep, such as the application of an opaque composite or internal bleaching for non-vital teeth, or, as in this case, you will see me use Boost Whitening Gel for the external whitening of 7 and 8, and a more opaque cement for the final delivery. At the final delivery appointment, you will see how Boost Whitening Gel, in conjunction with a more opaque cement that will mask the persisting dark stump, will result in a successful shade match. After the facial and incisal enamel reduction for the veneer on number 10 was achieved, caries were removed and cavities were prepared to be filled. To ensure that no calculus and no granulation tissue was still present around 8 and 9, the instrument was used to mechanically remove the calculus, and a soft tissue laser was used to remove the diseased epithelium. For the laser curettage, the Picasso Light soft tissue diode laser was set at 1.5 watts with continuous wave and initiated fiber. With light paint-like brush strokes, moving and keeping the fiber tip in contact with the epithelium, not with the tooth, I obtain a soft tissue ablation that will help reduce the inflammation and will support healing. The tissue tags can be removed with 3% hydrogen peroxide. Highly infected and inflamed areas will bleed, but the high photonic energy will produce coagulation and control the hemorrhage. The patient was placed in temporaries and then asked to return for the final impression after a waiting period of 6 weeks to allow enough time for the tissue to heal. At the final impression appointment, the temporaries are removed and the gingival tissue is evaluated. It looks nice and healthy and significantly improved from the first day patient came in. So we are now ready to proceed, knowing that there will be less chance of bleeding and less risk of obtaining an inaccurate impression. Here, the preparations are being pumice and the stump shades are going to be selected. I'll use double core technique to vertically and horizontally displace the tissue along with the camper caps to ensure capturing a clear margin. Capture medium body was used around the teeth and heavy body was used to load the full arch custom tray. As we see in this picture, due to the very dark stump preps, external bleaching is performed and boost whitening gel is applied on the non-vital teeth 7 and 8. For the delivery appointment, I asked the lab to provide me with 2 different sets of restorations. One set resembled the diagnostic wax-up that the patient initially liked. The second set had a more feminine look, staring away from the square contour of her old PFMs. Patient opted for the second set of BruxZir Anterior, giving her a more feminine smile. The case was seated with multi-link automix following the manufacturer instructions. Note that the multi-link translucent cement was used under the restorations on 7, 9, and 10, and due to a more persistent, darker shade, after the bleaching, multi-link opaque cement was used to mask number 8. To avoid microgap formation, I don't wipe off the cement. I tack cure for 2 seconds, then remove the excess while the cement is still in the gel state. After all the excess is removed, to further prevent micro leakage, I use liquid strip gel around the margin and cure for 20 seconds. With this aesthetic BruxZir material, I achieved every goal that the patient and I had for the outcome of this treatment. These new restorations have a nice ovate shape with centrals slightly longer than laterals, giving the smile depth and beauty and a feminine appearance. The patient feels comfortable to smile and interact in conversation without the anxiety of the previous restorative treatment flaws. Thank you for joining me today. Stay tuned for my next case, which will feature the highly aesthetic next generation of BruxZir material.
Thank you for that, Dr. Muresan. Well, that about wraps it up for this episode of Chairside Live. So on behalf of everyone here at Glywell Dental, thank you for watching, and I'll meet you right back here next time.